Hello everyone and welcome to this panel discussion organized by CNBC Arabia in association with Kearney. My name is Mayben Khadra and it's my pleasure to be your moderator. Technological innovation has been a hot topic in the healthcare industry in recent years, with spending on digital transformation alone surpassing $1.3 trillion worldwide, and it's growing at a whopping 10.4% year on year. Around 92% of healthcare professionals and institutes achieved better performance by introducing technological innovations and digital solutions in their work. It has become a common term in the media, but many people still ask, what does innovation and digital solutions actually mean, especially in the healthcare context? Most tend to believe that it's all about latest technology and equipment and forget that there are many different aspects to consider, having the triple aim as the key target in healthcare: better access, higher quality, and optimal cost. Here to talk about the future of the healthcare industry in light of the fourth industrial revolution, I would like to welcome our speakers, Mr. Mohammed Barada, Head of Healthcare Practice in Middle East and Africa and Kearney Partner, Mr. Yassine Bija, Chief of Enterprise Solutions and Clinical Pathways Europe, Middle East and Africa at General Electric Healthcare, and Mr. Michael Schalper, CEO at Anvano. Thank you so much for joining us. I would like to start with you, Mr. Mohammed, and the discussion about digital transformation. We talk about artificial intelligence, we talk about big data and machine learning. So how are these technologies improving care for the population in the Middle East?
So digital solutions are a blessing for healthcare. Not only do they lead to better patient experience and treatment, they can help save lives. As we all know, in the region, chronic diseases are of a high burden, and they lead to they're the main cause of premature deaths. So digital solutions like AI, machine learning, and big data allow for having information on high-risk groups and the possibility of early detection, the possibility of early treatment, and the continuous support to patients.
That's great. So Mr. Yassine, Mr. Mohammed was talking about early detection and of course early diagnosis, which means better life expectancy, of course, for the population. What other areas do you focus on when you look at how digital transformation can change and develop the healthcare industry in the region?
When I look at the digital transformation, I see that it comes at three levels, or digital solution, it comes at three levels. The first one is actually it brings transparency. So transparency by bringing all the data up that people can see it for key decision makers. The second level is actually around decision support. And decision support, once the data is transparent to people, that it prompts them to make the right decisions at the right moment. And the third level would be actually around automation. For the simple processes that can be actually automated, why not automate? If we have the data, we can directly automate the decisions, and therefore reduce the labor reduce the burden actually on healthcare professionals to make simple decisions and let them focus on what matters most, which are the most complex decisions.
So while making this transformation, while making this shift, to what extent can we make this shift while looking and focusing on sustainability, Michael?
On sustainability, that's an interesting one. Ultimately, we have to finally get away from sick care and start doing healthcare. Realistically, at this point in time, we are only focusing on the patient in a healthcare setting, not doing prevention. We heard it earlier a little bit. We have to diagnose early in order to treat early, which then also has a sustainable impact on the entire healthcare ecosystem, because you're eliminating an unnecessary burden, and with that have the possibility of focusing on the right population of patients that require the right services, leveraging technology to let technology do what technology is good at, but ultimately let the clinical practitioners, the doctors, apply what they're good at, which is maintaining, building up relationships. It's about making sure that the contextual information is being applied, that the expertise comes in. In a lot of instances, it's also about empathy. because empathy is something that technology will not be able to mimic for quite some time, but that is also not relevant. If you free up the time from the practitioners to finally focus on the more complex cases, then you have the ability to actually let them take care of that. But in 90–95% of the cases for silly conditions, you let patients be self-sufficient by obtaining advice from technology, with that putting less of a burden on the healthcare system.
So great. I want to go back to talking about the three main digital solutions that we're discussing today, which are big data, machine learning, and artificial intelligence. To you, Mr. Muhammad, which one is the most important when it comes to patient care?
Both AI and machine learning support a lot decision making in healthcare. And they bring a lot of transparency and new insights that we never had access to. They've been able to empower clinicians to make wise decisions, and by augmenting the intelligence in the system. Now, the other element that I think is very important is they've been able to reduce or at least minimize the number of errors. And in healthcare, this is very important. There is very little room for compromise, and there's also obviously very little tolerance for mistakes.
So minimizing errors, is that something that we can totally depend on digital transformation to actually try to eliminate?
Eliminate, I think, is a big word, and it's a big ambition, but we should definitely strive towards it. I believe AI will help bring, in a way, the median of the quality of care a little bit higher. It will help basically reduce that to a minimum as much as we can. Of course, we cannot rely 100% on only the machine. The input of the doctors will always be there and will be always important in a way to get the outcome. However, the AI will help in a way reduce that level of mistake, help give the doctors the right data at the right time, and help them basically make those better decisions instead of, because errors, no doctors will make decisions.
Zero error.
Zero error, but they don't make it in purpose, usually because of lack of data, or lack of visibility, etc. What we can rely on the technology on is to bring that transparency to them so they can make the best decisions based on the most accurate data.
So whenever I discuss the topic of digital transformation and technology, whether machine learning and artificial intelligence, in front of anyone around me, there seems to be an understanding that in the years to come, my doctor will be a robot. And I'm already starting to see in some hospitals that some robotics are actually doing very accurate and very complicated operations that needs a lot of precision. Is this the future? Am I gonna get into the point where I go to a clinic and my doctor is actually a robot?
Well, I actually would challenge you on that one, that you don't even go to a clinic. Why would you? If it is a machine,
yes,
why would you go there, right? You want to have it seamlessly integrated into your life. Simply use whatever you have at home, be it your smartphone, your smart devices, maybe even completely integrated in your smart home, because you want the care that you want when you need it, not waste time commuting. So for regular conditions, most likely, with the Internet of eyes and ears being omnipresent, you will be able to be better treated, diagnosed at home, and then take it a little bit of a step further. We have already at this point in time a lot of sensors with us, right? We are carrying our smartphones around, which is capturing a lot of data. Some are using smartwatches. It's not too far away that we'll actually have implants which are identifying medical conditions early on and directly get into a treatment mode, so that we maybe do not even feel sick anymore. And that is another possibility. So the 24/7 monitoring, which we see currently for high-risk patients in a home care setting, that will be more and more of a normal reality for us. So I would not be surprised if you will be treated most of the time by a machine.
Mr. Muhammad, is that something that should scare me? Please tell me.
No, it should not scare you. And in healthcare, there's always this regulatory net, and it's a sector that is extremely regulated, and the governments care for the patients, care for the quality of the tools, and make sure that they're only introduced when they are safe for the populations.
And I think the diagnosis as well will become even more accurate. You know, now we have to undergo, like, for some patients, they have to take like 5-6 tests to find what is really wrong. Now with this machine learning and artificial intelligence, I think that right in the future, I think in the 5 years to come, we won't be needing to make as many tests to find what's the disease.
100%. I mean, today we have already existing model of care where basically for breast cancer, we can basically go from screening to basically even treatment planning in 1 day. And that's how do we do that? By having the right model of care, by having the right technologies, by having the right algorithms to make actually the doctor see the unseen and see what is hard to see and hard to detect, and do the whole process in a very short time, thanks to the technological advancement, thanks to the data we can see and assess in 1 day effectively.
Because time can save lives as well.
100%. I mean, just to give you a number, I've read recently, only 18.5% of patients that are diagnosed with lung cancer survive more than 5 years. That's scary.
Yes, it is.
It's very scary, and fundamentally what the technology can help us by having screening, by having a diagnostic system to identify the disease early, that will fundamentally increase their lifespan and fundamentally help detect the disease at the time where it is actually easier to solve and to treat.
But are treatments as well, Michael, changing? Now we're talking about pills or serums and, you know, traditional medicine, but are we gonna get to a point where, I don't know, there might be a chip implanted for the rest of someone's life and it can actually cure him?
There's definitely a possibility. Realistically speaking, at this point in time, what do? We typically treat the symptoms and not necessarily the root cause. And we have to finally start identifying what is actually the root cause. In the case of cancer, so far, we don't know. There are just last week some recent advancements to potentially identify the basis or the root cause to some degree for some parts of cancer. So we have to finally get to the point that we understand what is actually causing a specific disease. In some instances we know it, for the more complex ones we don't. That will bring quite a shift for the pharma industry, because right now there's clearly a lot of revenue that is being generated with a lot of drugs being distributed. So once a drug can actually treat this specific root cause and get more into the area of precision medicine, meaning doing something that actually works for you and
personalized
just for you,
medicine.
personalized
Exactly.
and precision. Exactly. That is what we need, because ultimately who wants plain vanilla when it comes to our healthcare? When it comes to our health, we want something that is really spot on. And that will just increase. But maybe one topic or one point to the artificial intelligence and machine learning. It has a lot of value and a lot of potential. There's no doubt about it. But the foundation for all of that is structured and clinically curated data points. And at this point in time, we are facing so many data silos in the healthcare setting, which is making it very difficult. In addition to that, the average consumer, the average patient, is interacting 5 to 6 times a year of 20 minutes with the healthcare system. These are the interactions we try to diagnose, base treatment upon, in order to potentially recover that person. This patient also takes 364 days and 23 hours decisions that are impacting the lifestyle, leaving digital breadcrumbs out there. So if we were to correlate these digital breadcrumbs with the clinically relevant information, then we finally can get more towards a personalized medicine or precision medicine or even preventative approach.
This is a very interesting discussion, and of course we're going to continue after a short break. We will be discussing the ability of the healthcare sector in the region to access the innovative technologies that are reshaping this sector. And we are back, ladies and gentlemen, to a very needed and interesting discussion on the future of healthcare industry in the region and the major technologies that are reshaping this sector. So I want to discuss now this topic from an access point of view. Accessibility is a major major topic for the Middle East, because of course we are seeing some gaps. Some technologies are available in other, countries and more developed countries, and they're not available in the region. So I want to start with you, Mr. Mohammed, and how can we bridge this accessibility gap?
Look, indeed, some technologies are still nascent in the region. And this is very common when you have innovations in healthcare. They take time to settle. Now, what we know is the region is tech savvy. In many cases, we are ahead of the curve, and in many of the emerging technologies. And what we see in healthcare is that it is happening, and it is progressively happening. Obviously, there are factors like funding, regulation, training that will need to be addressed, but it is moving forward, and we are actually seeing that in countries like the Kingdom of Saudi Arabia, in the UAE, where they have actually started introducing regulations around AI in medical devices.
So, Michael, what's your perspective on that, the accessibility for the region when it comes to this technological advancement that we are seeing in the healthcare industry worldwide?
We actually see a lot of innovations in the region which we don't see in other parts of the world, maybe even reverse innovation, which might have been developed out of constraints that the ecosystem is facing. So that is quite interesting. You see more of them being adopted in the Western world, if I were to call it that way. In addition to that, we have in quite some rural areas, remote populations that need to be taken care of as well. But there's a shortage of clinical practitioners, of people that actually can provide the right care. This is exactly where technology comes in, because you can equip a less skilled clinical practitioner through technology, maybe even directly with the technology, or by putting someone remote next to the person to treat an even complex case in a remote area of, be it Saudi Arabia or whatever else it is. So we have to ensure that the access is there. The region itself, each of the countries here, is very different when we look at the East and the West. Why? There are strategic plans and visions in mind and in place that are actually advancing healthcare as one of the top priorities. And that is what we have seen when it comes to the digital transformation of the health facilities, which are now getting outside of the four walls of the health facility into the integration into the society, so that we can ensure access for each and every one wherever they live. Because ultimately, health...
This is what it's really about.
You're right. Absolutely.
So, yes, Mr. Yassin, go ahead.
And one thing I would like to highlight is also the region is actually quite diverse. I think we have countries in the region who basically have more basic needs of access to care and actually remote care. And you have regions which are actually very well developed. I mean, you mentioned the Kingdom of Saudi Arabia, the UAE have actually leapfrogged a lot of the technology and actually has gone way above what we see in the West. And there is no reason that other countries in the region can also go into this process of leapfrogging, going from not necessarily well advanced technologies and asset, and go into the most recent technologies. And from access, the other piece I would like to highlight is, remote care. So there is the access to the technology, but there is also patients accessing care. And to have patients accessing care, we see today that the technology allows today access to to manage very difficult diseases and to manage chronic patients remotely without necessarily needing to go to the hospital. You mentioned it earlier around actually remote care, wearables, the connectivity of the digital systems, enabling actually hub and spoke models. All these models allow potentially remote patients to have access to care more or less the same level that they can have in a central location where all the hospitals are or all the centers of excellence are.
So we're talking about a change in the business model for the healthcare sector, technically,
Absolutely.
right?
Yeah. Absolutely.
So
Absolutely.
Where is that going?
Look, access is a chronic issue in healthcare in the entire world. And COVID has shown the limits of many of these systems. But it's always also pushed us to think differently. The healthcare has been wired, right, to seek and provide services in the hospital. Now the models are changing. Like both Michael and Yassin said, we are moving out of the hospitals to providing care everywhere, in pharmacies, in community centers, at home, in step-down facilities. And telemedicine has also enabled a lot of this to happen, and there's the huge adoption of it in the region. It creates massive benefits such as less waiting time, better patient experience, and many others.
So you mentioned COVID and the rise in telemedicine following COVID, and that brings me to a very key question that we've been asking recently, is the healthcare industry today ready for the next pandemic? Please go ahead, Mr. Yassin.
Oh gosh, you put me on spot here. I think it's a billion-dollar question. I don't know.
Because there were a lot of lessons learned from how the healthcare sector globally have dealt with COVID. So yes, please go ahead.
I can probably.
Thank you, Mohammed.
I think as we start providing care everywhere in the community, start investing in prevention and early detection. Well, for one, we will have less of these. Right, and then two, when they actually do come hit us, we'll be very well equipped. And there are few systems out there that have invested heavily in primary care, in community care, and they were well equipped to actually serve their populations during the pandemics.
I mean, I remember, yes, Michael, and this is my question to you. I remember when COVID started and we went into global lockdown. Many developed countries has faced tremendous struggle with hospitals because there weren't enough hospitals to deal with those many patients. And that's why I ask, today with telemedicine and with this digital transformation, does that mean that we won't face the same problem during the next pandemic?
We wouldn't face the same problem if we eliminate the data silos and actually track everything on a global level when it comes to that. Because if you would have identified that there is an increase in region ABC of the following respiratory problems, high fever, can't be treated properly, and, you would be able to contain it more. So it's also about identifying where specific patterns are occurring in order to take the right actions to influence behavior. That is something that most likely we humans are not necessarily good at. So let machines do that, right? Because we cannot necessarily monitor such a vast amount of data. But in addition to that, it also means collaboration with all the countries in the world to make sure that such crucial and critical pieces of data are exchanged to avoid a situation that we faced 2 years ago, which impacted all of our lives, and most likely a lot of us lost also loved ones, which is something we have to avoid.
If I may just to add to this, because I think, one thing where COVID helped, if I may say, the way you use this word, is actually really accelerated a lot of the transformation, in healthcare. Who imagined we're going to do telehealth today, 2-3 years ago? Never, no one.
Yes.
Going outside of the hospital, managing the patients outside of the hospital, it was actually a massive block. Everyone thought it was a good idea. Everyone thought that should happen. But in reality, no one ever dared. Now a lot of the healthcare system, a lot of the regulators enabled this approach, and we see, for instance, now in the UK, they're suffering with 6 million patients waiting for elective surgeries after COVID. They're still waiting. Now what they're doing, they're creating a lot of models, they're creating a lot of community diagnostic centers to help capture a lot of this volume. So fundamentally, I said I don't know, fundamentally the system does know better. We are actually taking actions everywhere in the world to be readier. The question, are we ready?
That's a big one.
That's the
$1 million question.
Exactly.
So 3 or 4 years ago, prior to COVID, if someone has told me about telemedicine and that I can, see my doctor right at home and he can just write me the prescription and actually I can get my medicine right to my room, I would have laughed. Today we're talking about virtual hospitals. Indeed. In the metaverse, and as kind of weird and out of this world as this concept might sound, at least to me, some are actually betting on it.
Yes.
To what extent are we close to having virtual hospitals? I mean, the technologies of metaverse, what does it mean for the healthcare industry?
Look, we are moving into the metaverse, and healthcare will not be an exception to that. So it will ride that wave, and it will take the time to do it. And indeed, we're talking about virtual hospitals, virtual clinics, and we're seeing some elements of it. Now, the metaverse, I see it offering immediately two main benefits to the healthcare system. One is the training of doctors, right? As they do procedures and repeat those procedures and repeat those procedures, they get much better, right? And it improves the quality of care. The metaverse allows for that environment, for them to practice, for them to do those procedures over and actually try out other elements in that procedure. The second benefit that could potentially happen and could be truly beneficial for patients is mental health. Mental health, there is a need for many to consult and to seek mental health services. We know there is a gap. Now, there's also a lot of stigma around this concept. Providing an environment where you can be anonymous, you can be with others.
Lifts the stigma.
Lifts the stigma and opens up access to mental health that is very much needed by the population today.
I love that. A recent Harvard Business Review study showed that virtual reality trained surgeons had a 230% boost in their overall performance compared to their traditionally trained counterparts. This is already, it's already in the making.
100%.
Absolutely.
It's fully in the making. You have to realize also in such a setting, such as a surgery, there's a lot of stress, there's a lot of pressure, and you have to function. So the more you actually can train that in quotes, life environment, the better it is, because you will just turn on the switch and you will function. In addition to that, that is where camera fusion, artificial intelligence comes in to really complement what you're doing, constantly monitoring that and intervening, or at least highlighting, you know what, you shouldn't put the clip here. Why? Because it is about 2-3 millimeters too low. Severe risk to the patient, put it higher. The cameras are there anyway. If you then have augmented reality headgears, that means it will not interfere with the procedure that the doctor is doing, but it actually will complement it and save lives. You're absolutely
Just to
right.
give an analogy, I mean, simulations for pilots has been there forever, right?
Yes.
Have we seen a lot of simulations in the past for doctors? Not as much. And that's exactly what Mohammed was talking about. That's exactly what this technology will allow. People get better by doing the same thing again and again and again, and doing some of the complex procedures that they were not necessarily able to do otherwise virtually, and be just better. It's about hands, it's about practice, and I think that's actually a benefit that we probably will see in many years to come, but I think it will be fundamental to the outcomes.
So hearing all your thoughts, I think that anyone watching this panel will actually have higher confidence in the healthcare sector in the years to come. But the question is, what is the cost? This is what we're going to be talking about, but after a short break. And we are having a very interesting discussion with our panelists today, discussing the region healthcare industry. And now we will be discussing costs. It's the topic that currently no one would like to discuss, with rising inflation, rising commodity prices, the pressure on, populations around the world are facing because of the inflationary environment. And of course, the healthcare industry is one of those key industries that are also having to deal with a very tough economic environment. So the question is, to what extent are technologies lifting some of the pressure of the healthcare industry when it comes to costs? Mr. Yassin.
Yeah, I think the moment we start looking at it as a healthcare industry and we look at the patient care end to end, then we're going to see possibilities of cost reduction. We spoke earlier about early detection and early diagnosis, for instance. The ability to diagnose patients early is fundamentally helping the patient's outcome, but also reducing the costs of taking care of that patient at a more advanced stage. Because actually a patient who's very sick will fundamentally cost the healthcare system a lot more than a patient who's treated earlier. I think that's fundamentally something that we tend to forget, but it is a shift. We should not look at the technological costs. We should look at the cost at the healthcare system level. One other example I would say, I mean, Mohammed spoke earlier about medical errors, right? Medical errors is also a huge cost. The more technologies we have that can help reduce that phenomenon of medical errors, the more costs we save. Another example, we spoke about virtual care. Virtual care also, the technology might seem actually costly, but fundamentally it does bring costs down. And I think all these examples are examples of how technology, we can only do that because of technology, but how technology can help reduce costs on the healthcare system level and actually also improving patient outcomes.
So it's not only about making the healthcare sector or industry more efficient, because preventing is also does a cost cutting. When we talk about technology, it does as well, but there are different aspects to it, right, Michael?
Well, if you look at chronic conditions, which we have quite some in the region, and they are a ticking time bomb, we have to manage them effectively. Take diabetes. If diabetes is not managed effectively, the cost to the healthcare system is excessively high. However, if you were to manage that patient with remote monitoring technology by actually being seamlessly integrated into the lives in terms of the services, the monitoring, you will be able to lower the costs quite substantially to the healthcare system. That in the end means also this costs that you're saving is freed up potentially to be reallocated. But there are many other aspects. Surgical site infections we mentioned earlier on as well in terms of the medical errors. Utilizing technology can avoid a lot of those. And there are different aspects you can really look into, but ultimately it's also about making sure that we use technology to take a lot of the burden away from the clinical practitioners. They are a scarce resource. We need them for the complex cases, and that creates efficiency in itself again. Because a regular doctor, you learn 10,000 symptoms during medical school, use regularly, maybe 100, 200. Well, a machine will constantly check against all of that for the common conditions. And if there's a need of an intervention to access to a medical practitioner, that will happen. And this is exactly where the expertise comes in. That can drive down the costs to eliminate silly tasks and focus on the important ones.
And when you save these costs and you make bigger savings, you can actually invest in technological advancement. You can invest in bringing more innovation into the sector, right, Mr. Mohammed?
Absolutely. And just to put things in context, because we hear this a lot, cost savings, and it gives the impression that we will spend less in healthcare. This is not true, right? Our populations are growing. Our people are living longer. So by definition, we need more healthcare services. So when we think about costs, it's not about reducing the overall envelope. That envelope will continue to increase with the population increase and older age. It's about the better use of funds. It's about limiting the growth in those funds. And both Yassine and Michael have highlighted these points. So I think it's very important that we understand that it's really about better uses of our resources, and technology is a key enabler to that, to achieving that outcome.
And it's about the incentives in the system as well. Because as long as you have a revenue-driven healthcare system, you will never get away from the death spiral where you're basically in. You have to focus on value-based care and outcome-driven healthcare system to counter that effect. And you have in the region, Dubai being one of them, already value-based care models being implemented. That is shifting the entire value chain, or how we sometimes say follow the money within healthcare, because all of a sudden you get incentivized by providing the best possible treatment that eliminates readmissions because the patients are getting the best possible outcomes. And that is, I think, one of the aspects we really have to push forward.
I just want to give a context to why are we discussing the future of healthcare. By 2050, the world will be home to 10 billion people, and 2 in 5 of these people will be aged 60 or over. This is just, these numbers are actually shocking. We're talking about 434 million over 80 years old. And that means that demographically speaking, we need a stronger, more resilient healthcare sector. What do you think, Mr. Yassine?
I think we do, and Mohammed explained it quite clearly. I think the population is the population, and I think healthcare, and that's why the fourth revolution in healthcare is important. Healthcare has been one of the industries that has less transformed in a way of how we operate, because it was very people dependent. And the technology today is enabling us to be more reliant, bring standardization, but also optimize the process of dealing with this, with the new population and the people we have in front of us that will come in front of us. So it's a lot about optimizing how we operate, trying to kind of go into more value-based models to reduce overall healthcare system cost and managing it from that perspective.
Mr. Mohammed, I want to go back to a keyword Mr. Michael just mentioned, which is the healthcare industry should be more value-driven rather than revenue-driven. Looking at these numbers and looking at technologies and the digital transformation we are seeing, to what extent does it actually put more pressure on the healthcare industry to be more value-based rather than revenue-driven?
No, I totally agree with Mike. We are moving towards value-based, and even the payment systems and models are changing. Mm-hmm. So, for example, historically, everything was paid by activity. We are progressively moving into payments by capitation, right? So, where a system, an integrated system, is responsible for the health of their population. And as soon as you do that, different thinking, there's a change in thinking that happens, where we start thinking about investing more in prevention and moving the system from a curative system to a preventative system. Mm-hmm. And in the process, it's really about also empowering the citizen and empowering the patient, where they take care of their own health. They're very much empowered with tools, with data, with several elements where they start caring about what they eat, they start caring about what they breathe, and they start caring about their lifestyle. And that will make a significant change in how our systems work.
When I check the news every morning, a trendy topic that keeps coming up is the topic of cryptocurrencies. And it's really funny that now the world is coming to realize that with this much digital innovation, we need a different regulatory system. And I think because we're moderating this panel today and we're talking about the future of healthcare with fourth industrial revolution and digital transformation, I think this applies to the healthcare industry. We need a different regulatory framework. But what factors should be taken into consideration when building this environment and this regulatory framework, Michael?
You have to ensure the safety of the information of each of the patients. But on the other side, it also has to move in a governed flow. So we are all global citizens, right? We are traveling around the world, we are on vacation somewhere, working remotely, whatever else it is. God forbid something happens with us at that point in time, and our information is available, we have the chance to potentially very effectively be treated. But if it is not available, maybe even a worst case scenario, it results in death. So we have to ensure that the information follows us and is available when needed, and ultimately we should be able to have access to our data points anyway, not have them in different silos. You mentioned cryptocurrencies. We're reading it in the morning. For a lot of us, maybe it hurts a little bit to read that. But the underlying technology, blockchain technology, has such a huge potential for healthcare. The way the data can flow in a very governed way, or at least in a very private and secure way, but then the data governance still has to advance, and that has to advance not only on a country level, but actually on a broader level. The fun fact is, healthcare and financials are the two things closest to our heart, right?
Yes.
We completely trust the financial system with our finances around the world. Well, what about our health? Maybe that's a little bit more important.
Mr. Mohammed.
No, two other, probably beyond the data protection, probably two other come to mind. One is you're going to have a lot of introductions of new technologies. So I think it is important to have a healthcare assessment, healthcare technology assessment framework, that we're sure that whatever is introduced is safe and effective. The other element that may come to play and will need regulatory support is as you have more and more players actually serving a patient, it's important to understand where the accountability lies, right? And this is new to the system and will require a regulatory framework.
Accountability, that's a big word. I mean, if a doctor did an error, I can sue the doctor, I can sue the hospital, I can sue the medical institute. But if a robot, if a machine did something wrong and caused harm, how do you hold it accountable?
Maybe a little bit of an analogy. Think 10 years in the future. You're on a nice windy mountain road with your self-driving car. And you have this urge to do it like back then. You know, you want to take control, drive yourself,
yes.
go up the mountain roads. All of a sudden you lose control, cause a crash. What is the first thing that the insurance company will ask you?
I don't know.
Who drove?
Were you? Yes.
And if it was you, most likely you get full liability,
Yes.
or at least partial.
Yes.
Because it was completely irrational that you let not the computer drive. So would it be too far-fetched to actually think, if AI is not consulted prior an intervention, that would be potentially considered maybe malpractice? Might be a little bit of a challenge for our thoughts, but shouldn't be too far-fetched.
So it's obvious that we need a new regulatory framework to put everything into context when it comes to digital innovation in the healthcare industry. I have 2 minutes left. I want to ask each one of you, where do you see and how do you see the healthcare industry 10 years from today? Mr. Mohammed.
I see the healthcare industry completely transformed, where patients would be a lot more engaged. They would know, they would have many tools, mostly digital, and they will take responsibility and accountability and charge of their own health. And in the background, I think that health is going to be everywhere, right? Not just, again, not limited to hospitals, but wherever you go, you will be able to have some sort of health service.
Mr. Yassin?
I'm not sure if it will happen in 10 years or not, but at least let's put it as a dream for me, is effectively that we effectively move to value-based care. We effectively move from treating patients who are sick to maintaining all of us healthy and having an ecosystem that enables us to be managing patients and actually managing people and keeping people healthy. That would be a dream of mine. Not sure if it will happen in 10, 5, 15, but that would be, I think, a model where we should all aspire to, because none of us wants to be sick fundamentally. We just wanted to stay healthy and would like to have a health system that kind of help us remain healthy.
Mr. Michael.
Maybe just to add on to what Yassin said, we are already seeing the boundaries of healthcare blurring. And I hope that in 10 years' time, we're not even talking about that anymore. We're talking about health, life, and well-being as one entity, because that is ultimately our life, fully focused on the foundation of value-based care, prevention to avoid what is avoidable, and with that, hopefully enable all of us to live a healthier tomorrow.
For me, I think it comes to less technical than that and maybe more simpler. I just want us to find more cures for diseases that now cannot be cured. They can be only treated maybe with technology, maybe with a chip, maybe with robotics. We can find cures for lung cancer, for breast cancer, and for many other diseases. I want to thank you so much for joining us today. Mr. Mohammed Barada, Head of the Health Practice in Middle East and Africa and Kearney Partner, thank you so much for being with us.
Thank you,
Mr. Yassin Bija, Chief Enterprise Solutions and Clinical Pathways Europe, Middle East and Africa, GE Healthcare. Thank you so much, Yassin. And Michael Schalper, CEO at Anvano, thank you so much for joining us today.
My pleasure.
And as the healthcare industry faces new challenges, technology solutions are helping leaders to improve performance, increase collaboration across systems, and manage costs. As demands on organizations increase, healthcare technology can streamline processes, automate tasks, and improve workflows at a scale. Thank you so much for watching this panel, ladies and gentlemen. Goodbye.